Assalamu alaikum. Thanks to the moderator, Dr. Jahangir Alam, and first I would like to express my heartfelt gratitude to the organizing committee for allowing me here. Honorable Chairperson, Professor Dr. Kaji Manjur Kader Sir, Professor Dr. Khondokar A.K. Azad Sir, Dr. Firdous Shahriar Sai, and all other dignitaries present in this hall. Good afternoon. I am Dr. Md Mobasser Rahman, working as an associate professor and the head at the Department of the Radiotherapy, which at the Shohid Jarrah Medical College Hospital situated at Bogra district of Bangladesh. My topic is in cervical cancer treatment, the role of paracervical block at timely brachytherapy. Then, brachytherapy is crucial for treating cervical cancer. The American Brachytherapy Society stated that the brachytherapy combined with the EBRT, it should not exceed over the 8 weeks. Our department offering the brachytherapy in this year from the April. Due to the numerous surgeries and the shortage of the anesthesiologist, we face scheduling issues that delayed our patient treatment. In search of solutions, I found that the Dukan Comprehensive Cancer Center at Baylor College of Medicine has implemented an effective approach to provide timely treatment without need for hospital admission, which was published in 2021 by Elsevier Inc. on behalf of the American Brachytherapy Society. Material and methods. Previously, at our department, patient received brachytherapy following the workflow. On the day one, that is first day, patient attended and got herself admitted at the gynae department and undergone acid test for anesthesia checkup. And next day, they went to the PACU room for the anesthesia approval. And the third day, they arrived at our department. Our department is giving the service daycare basis. At around the 10 a.m. for CT simulation, target contouring, and the 3D planning. The treatment plan involved 24 gray in 3 fractions as per the Reo et al. With CT-based planning using Gay-Castro protocol or recommendations. After treatment and implant removal, the patient was returned to the inpatient department for post-anesthesia rehabilitation. And finally, last day, the day 4, the patient was discharged after evaluation. So there need for day for single incision brachytherapy. But now current procedure, after adopting the current procedure, we just take 3 hours, but patient just 3 hours is enough for single incision brachytherapy. Patient are asked to arrive at our department around 9 a.m. Then our nursing staff ensures they have taken oral analgesia. At 9:45 a.m., patient is positioned on the brachytherapy table for examination. After bladder catheterization, paracervical block is given, then device insertion and the packing are done. At around 10:15, the CT simulation is performed. Then contouring and the 3D treatment planning are done in the next hour. And the treatment fraction is administered and the device removed and the patient discharged by noon. Evidence for paracervical block. Literature indicates that the paracervical block is effective for pain management during cervical dilation in hysteroscopy and endometrial biopsy. Also applicable to procedure like laminaria placement. Again, the Department of Radiation Oncology at the Dan L. Dukan Comprehensive Cancer Society at Texas, USA has successfully performed many ICBT using the paracervical block. Patient selection. Patients with inoperable say service who voluntarily presented at center, that is at our center, for brachytherapy after completion of the EBRT. 13 patients were enrolled from July to October this year. Technique. Patients are instructed to take medicine orally as per multimodal analgesia guideline 1 hour prior to the procedure. Vital signs are monitored accordingly. About 10 milliliter of 2% lidocaine gel is applied to the vaginal canal before paracervical block. Administer 10 milliliter of 1% lidocaine in 2 injections, 5 milliliter each, at the cervical vaginal junction about 2 centimeter deep. Lidocaine is injected slowly over 30 seconds. More time is required if you need or allow larger volume, using 20 or 22 gauge spinal needle. Wait for 3 minutes for getting full effect from the lidocaine, and then main work is started. Patient selection. Patients with This slide showing the multimodal drug analgesia which are used. There are 5 drugs. All drugs are given orally 1 hour prior to the procedure. Morphine sulfate, dose 15 milligram for pain relief. Lorazepam 1 milligram acts for getting anxiolytic effect. Gabapentin 300 milligram for getting adjuvant pain relief. Ibuprofen 800 milligram to reduce the cervical spasm, and the promethazine 25 milligram for getting antiemetics. And this slide showing the diagram illustrates the paracervical block injection site at 4 and 8 position. The cross mark indicates the injection site. Result. 13 screen patients were eligible for ICBT. 1 experienced diarrhea during that day, and we referred that patient to the diarrhea center. Next, the rest of the 12 patients, a total 36 intercavitary implant, was successfully completed using PCB, the paracervical block, achieving 100% success rate in case of pain. 2 patients felt discomfort while setting the speculum, which was overcome by doing more counseling, resulting in no pain reported at the procedure's end. The median dose at 2 cc volume for rectum and bladder was 62.8% and the 83.3% respectively, and the median dose at CTP at 90% was 6.9 gray, and within the bracket it shows the interquartile range, and all value are within the cover the reference value. Conclusion. By this way, by adopting this technique, the brachytherapy makes more easier for the patient to receive brachytherapy without compromising the dose. And requiring only a portion of the day for treatment, it reduces the healthcare cost and can be adapted for low resource areas and will increase the accessibility of curative brachytherapy. And this was my all. And last slide, it is the reference from where I got the idea and the guideline. And thank you very much for patient sharing.